Hey, everybody. Welcome back to our Tuesday chat, the Be Strong Group's Tuesday chat. Hi, I'm Brenda Green, founder and CEO of the Be Strong Group. As you may know, my husband and I funded this nonprofit in honor of our son, Braden, who has sickle cell disease. And our mission is to spread awareness through advocacy, education, and empowerment. And we decided to host this Tuesday chat editions to share about topics and people and things that are important to those with sickle cell disease as well as their caregivers. And if you've been with us for a while, you realize that a lot of the topics is actually applicable to a lot of people. So, and we just want to keep sharing. And I want to thank you all for being with us during the month of September, Sickle Cell Awareness Month, where we shared so much information. We invited other sickle cell advocates and warriors to talk with you and to share. And it doesn't stop. It didn't stop with Sickle Cell Awareness Month. Advocacy, especially for me as a mother of a warrior, it continues and it's every day of the year. So I'm so excited to welcome another special guest. And I'm going to read some about her before I bring her on to the stage. But I want you to know before we get started, everything that we provide to you is for educational purposes only. And if there's anything that's specific concerning the health of your child or yourself, please seek advice from your primary health care provider. But our special guest tonight is Nicklaine Paul. I met her, like I said, a lot of times with some people on these advocacy streets. But Nicklaine is a registered nurse specializing in the care of individuals with sickle cell disease. And her personal experience living with this chronic illness, along with her clinical expertise, she is in a unique position to serve as a subject matter expert. Ms. Paul assisted with successfully establishing the Sickle Cell Infusion Center for adults at Johns Hopkins Hospital in 2008. And during her tenure with Johns Hopkins, she was lead clinical nurse manager for close to 10 years. So to this day, Ms. Paul actively participates in the Johns Hopkins Hospital sickle cell initiatives and research as a nurse consultant. So in addition to her nursing experience, includes working as a triage nurse for general internal medicine at Johns Hopkins and working as a certified case manager for two top companies, including Care First, Blue Cross Blue Shield. And further, she assists law firms as an expert nurse witness on medical malpractice cases involving individuals with sickle cell disease and is now pursuing her legal nurse consulting certification. More recently, Ms. Paul has launched her nursing consulting company, Sickle Care Solution. You guys, please welcome to the studio, Miss Nicklaine Paul. Hey,
hi everybody! I'm so happy to be here. It's an honor, truly. Thank you, Brenda, for having me on.
Oh, thank you for joining us. And you guys, like I said, I met Nicklaine in these advocacy streets.
Yes.
We did an event with the American Red Cross, and you guys know that's one of our main initiatives is encourage blood donation in our community. But I was so inspired by her story, and I had to share it with you all who are watching tonight. And Nicklaine, I know I read some of your biography, but please, can you share your story and
Sure.
then talk to us about what you do.
Sure, I would love to. So I was born in Haiti. So my mom and dad both are sickle cell trait carriers. And my mom's retired now, but she's a registered nurse. I don't think you ever take off the nurse from your name. But so they were aware, right, before having children, the possibilities. So in Haiti, 5 years old, we came to the US and then we settled in Silver Spring, Maryland. And I actually was a patient at Children's Hospital right here in DC. A little bit after that, like middle school age, we moved to Connecticut. My dad is a minister, and so he moved us out there to start, oversee his own congregation. After that, I went to nursing school for 4 years in Connecticut, and I knew from a very young age that I wanted to do sickle cell specifically, and following my mom's footsteps, of course, right, of being a nurse and being a super protective mom, Caribbean mom at that. She was like, I don't know, do you really want to go into nursing? It's so exerting on the body, right? Because you have sickle cell.
Mhm.
She knew, I knew what I wanted. I was very passionate about the care that I did receive, and I wanted to do it even better than what I, got when I was a kid and growing up and being into an adult with sickle cell. So I moved to Baltimore, Maryland in 2008. I just happened to attend an annual conference with SCDAA and happened to sit on the same table as one of the physician assistant that, was looking forward to opening up the clinic in really just a few months. We got to talking. Moved 3 months later, I moved. And so we opened that clinic together. And today it stands as a model nationwide. And we've even traveled globally to Middle East, Saudi Arabia, and Bahrain to help them even open up their or improve their healthcare system for sickle cell. So that has been my life's passion, working in sickle cell. I have it. I have experienced my share, of crises and complications, but I am healthy. I'm happy to say, and as we know, and some may attest to on this platform, is that we can live full, healthy, happy lives, right? With the right quality care, the right, support system, and all of those things, and the right education of our own disease, right?
Right.
And so for me, I said, why stay at one institution when I have such a wealth of knowledge that I'm so passionately wanting to share? So I said, you know what? I'm going to do it for myself. And so I could go national, global without any restrictions. So I started Sickle Care Solutions just this year officially. And so I have Sickle Care Solutions. It's a three-prong approach: educate, serve, and testify. That's my branding. And so with Educate, I do things like this, right? Talk to public, healthcare professionals, nurses about sickle cell and how to do it best, right? How to really treat this well. And then Serve, I actually help clinical teams who are interested in opening up their own dedicated spaces, which we know is the best environment to get the quality care we deserve, open up their own dedicated spaces, because I did so for Johns Hopkins. And then the last prong, which we could talk about, I remember being 13 years old, hearing, if you live past 25, we'll be happy. Whether or not those are the words that were said, that's the only image and memory as a 13-year-old I walked out of the room with, right? And so knowing that, a lot of families and individuals living with sickle cell disease have heard for quite some time that, oh, sickle cell causes early death, right? Now, yes, okay, the average was 10 years old. Now we have increased it to about 40 plus. So it's not necessarily sickle cell that caused a medical injury or a medical death. It could have been something as far as the clinical team caring for that individual falling short of standards of care. And so I review charts, I testify, and say, you know what, is justice here to be served? And so that's the last part of my business. And I'm excited to be here. Any questions?
Right. And I want to show you, we had a couple of welcomes when I asked them, our followers, to welcome you. So you're definitely welcome here.
Hi.
And Nicklaine, what captured me, and especially me being a mom of a warrior, is the fact that you yourself has sickle cell disease. You know, and you're not letting it limit you in
Yeah,
that way. But a key part, and I know you mentioned and touched on it, a key part of it is, um, it takes effort
it
to
does.
make sure you all are doing what you need to do to stay healthy and to live an active life.
Definitely.
So, explain to us how that piece of it plays into what you're doing now and starting it, motivating you and starting your own business.
Sounds good. I remember, having sickle cell and really understanding that something is different at a young age. You can't really quite put your finger on it. You can't 100%, explain it, when you're early childhood. But, there are certain things that come into place, or you start to understand your limitations, right? And I think one of the strongest things, or one of the best things that we can do, is really have a strong support system as best as possible. My mom did have medical knowledge, so that helped. But I still talk to her to this day, and she says, I felt lost. Like,
Wow.
right? Like,
Mhm.
I didn't know where to turn. Like, nobody really had a great group. And that's why Be Strong is so, like, to me, inspirational, because it's group like this that help parents not feel such fear, right? Because there's support. So growing up, I remember one of the best things she could have done for me, and I urge this for a lot of parents, is at a certain point, when you start to understand the maturity of your child, um, living with sickle cell disease, you of course have to understand their maturity level and when it's best to introduce this, but really teach them how to be their own self advocate.
Mhm.
My mom, I remember 12, 13, she was like, oh, no, 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 don't ask me. This is her. Ask her. Because oftentimes, as a pediatric, individual, they kind of see you, but you're not really there, right? As mom, right? Or dad, right? And so the questions are kind of geared towards parents as opposed to the person living it. Even
Mhm.
though we're young, we need to learn early on how to speak up for ourselves. And I think that's one of the key things I definitely want to encourage everybody to do. But kind of experiencing this, and, experiencing this illness, really understanding my limitations. My mom kind of gave me some leeway,
Yeah.
to understand where my limits really are. And I think with that, I kind of grew a confidence and an understanding that, what, I have sickle cell. Sickle cell doesn't have me, right? And I'm sure a lot of people have heard that saying already. And it's so true, right? So I think the more you're able to experience and understand what your triggers are, okay, no, if I, do this much today, I need to rest more tonight than I and take it easy tomorrow, right? Okay, my family wants to go to Six Flags. What does Six Flags look for me? I don't want to look like for me. I don't want to necessarily miss out on a great opportunity and a fun-filled family day, but maybe I'll skip the wave pool this time because
Mhm.
this is too much. I'm pushing myself too hard, or oh, mental stress can be a trigger, right? And just knowing, oh, my cup is overflowing. Like, I'm a little, at a peak. So really being able to speak up for yourself, I think, has really taken me so far, because I got to understand myself. I got to understand the disease. And then, so therefore, I think I was a better nurse for it.
Oh, wow. Oh, so I know you mentioned a couple of things which
Sure.
reminded we have one mom that I know, and her son Royal. He says that he said, I have sickle cell, but sickle cell does not have me. And
Yes.
he's 4 years old, and he says that with so much confidence. So glad you mentioned that. But you also mentioned about us as parents teaching our kids
Yeah.
to advocate for themselves. Now, that transition period from
Mm. Let's
pediatric
talk. Let's
care to,
talk about it.
yes, please, can you talk about that part?
Okay. All right. So I'm going to be very transparent, okay?
Okay.
Because I'm on both sides of the fence. I have transitioned. I have been a nurse receiving adults who have transitioned, okay? Because again, just so everybody knows, I'm more adult care than I am pediatrics. Now,
Mhm.
I have helped the pediatric department with, game nights and support group, and help, Mary to, help pair up an adult with pediatric just to help, as an ambassador of sorts.
Right.
But let's talk about it. So the transition phase is probably, and I don't want to say one size fits all, right? But traditionally, we know transitioning from pediatrics to adult care is the toughest phase. Why is that? Because you have a couple things working for us in this phase. So, one, we're dealing with a teenage age, okay? So, that invincibility kind of, I am my own person. I am, really trying to stretch to understand what adulthood looks like, versus what I was not able to do as a child, right? And I'm now able to kind of speak for myself in many different ways. I think that plays one piece. Another piece, I think oftentimes there's a fear built in, because as a pediatric patient, you are well taken care of more often than not, right?
Right.
Because you want to take care of the baby, right? Like, so pediatrics tends to have a lot more resources. Now on the community level, maybe a little, when I say a lot, just in comparison,
Mm-hmm.
right? So, pediatrics, you have the pediatrician, you have social, you have a lot more resources. When you transition over to the adult side, which is what I'm really working hard to change, you have less resources. And now you better understand what we're talking about, right? This is the mentality of healthcare workers on the adult end. It's, I'm just going to talk to you as an adult, right? I'm not going to differentiate necessarily a 28-year-old to a 38-year-old or a 22. It's like, at this point in your life, I'm imagining, or what I often discourage healthcare professionals to do is assuming you understand sickle cell, you understand your medications, you're either compliant or not, and things are kind of put on you as an adult very soon. So if the transition phase is not properly cared for and taken into account in many different ways, then we often find that there's a chasm, or we lose people because they either fear transitioning, right? Because they were cared for so well when they were younger, and that trust relationship of your pediatrician and your hematologist from such a young age. So now you're going to a whole new team. You don't know what to expect. They're expecting you to, and oh my God, my mom can't come into the room with me. Excuse me, right? And
Right.
so, it's a lot of pieces to that pie, right? But we have to do a better job with the transition period.
Oh,
Yeah, because I think that's a place where we lose a lot of people for all of those things I already said. And one of the things that I try to do is actually talk to the pediatric nurses, because I remember being holding transition night at Hopkins, and I just kind of, I'm on both sides of the fence. So I just talk openly, right? And I was like, what is it about, I was speaking to some of the, adolescents ready to transition. And I said, what is it about transitioning that you guys are so scared? Like, what is the fear, right? Like, really help me to understand. And I was astonished that more than one said, honestly, it kind of started with my nurse. On the pediatric side, that wasn't something I was expecting to hear. And I said, explain. And the nurses kind of say, oh, you're about to transition. They don't have colors on the walls. And, it's setting you up to have this anxious, like, you don't know what to expect. It doesn't sound good. Whatever it is, I don't know what's over there, but it doesn't sound good. And so I think as healthcare professionals, we have to be very careful with our verbiage, how we express things, how we support the individual in all phases of their life. I think that's one of the biggest drive home things for me when I educate any group.
right. And we had a comment who was responding to something you said about, sometimes you can't assume that an adult sickle cell patient will know
Mhm.
about sickle cell. So you're correct about the education piece and how to
Exactly.
communicate, right?
Exactly. And I remember we started to implement, there was a period of time where we started to take on the monthly transfusions right in the clinic. Previously, they were done in another department. And I'm a huge advocate for education. That's like the foundation to me. And when you know better, you do better, right? And so for me, in preparing and starting this venture, or this new phase in the clinic, I would ask simply, I would say, hey, okay, do you understand why you're on transfusions? Mind you, some of them have been on transfusion for years, but I'm starting new. I already, of course, these are my patients. I know you, but this is a new therapy that I am, as now the nurse, giving you. Do you know why you're taking it? And I was shocked to know, are shocked to hear how little really the depth of what are we looking for? What are the labs we're assessing to see if transfusions is successful? And so from there, I started to, every time you came in for a visit or a transfusion, I would print off your labs and I would say, okay, the red blood cell, this is your hemoglobin, this is your, S percent, this is your A percent, which is the normal, right? So what I quickly found out is they were on time for their transfusions. They were scheduling their next transfusions the very, time that they were leaving from that one to for the next. Because when you know and you truly know, then you are not only more compliant, but you're a strong self advocate. So, because what I helped individuals to understand is, if you're in a situation, an emergency, and you have to go to an outside hospital, I need you to know what to say, and
Yes.
how to guide your care. And so I think that's always the key.
Oh, absolutely. And I know we have another organization who's watching, and they're saying they're built on education, and that is so important. It's
Yes,
important to educate our warriors, it's important to educate our caregivers. And as you mentioned, Nicklaine, it's important to educate our healthcare providers as well, nurses
very.
as well. Um, so that is a concern. That's a concern I have. And I know here, and I know a lot of places, there's a big, huge difference in pediatric on a pediatric clinic versus going to the adult sickle cell clinic, even here, um, in the care of our warriors. And how do you go about, how do you go about even setting up a session or a workshop or something to educate a particular caregiver group or group of nurses? Or, I mean, how do you go about setting that up?
Sure. So for me, oftentimes I'm actually contacted. It's usually, it's funny enough, a lot of things happen word of mouth, right?
Mhm.
So, if it's somebody, let's say somebody attending today that's like, oh, I heard this person is, and you wouldn't imagine the web of contact, right? And so oftentimes I do have a website, so www.sicklecaresolutions.org. So I do have a contact page, and that goes directly to me, and I can definitely speak to anyone. um and so that's a way that, and some people have my cell phone and some people have my email. My email's npaul.rn@sicklecaresolutions.org. So but if it's a clinical team, I often set up, okay, what is exactly the agenda, exactly who's the population, and what is our goal? Because oftentimes it's more, well, we have some, um I remember one consultation, and everybody's gonna cringe on this call, okay? So brace yourself. And they were like, we have sicklers. And I was like, whoa, whoa, whoa. Wait a minute. Okay, I need you to never use that word again. And they're
Right.
like, oh, I'm sorry, did I offend you? I was like, we as a community do not like to hear that word. It literally raises the hairs on the back of our heads. We do not, we don't, it's such a, it's a word filled with, anyways, but I'm gonna get off my soapbox now. But basically what it was is, what's the goal, right? And what are we really trying to gain? Because oftentimes there's a question on what exactly are we trying to do. For me, I think patients always come first. Individuals with sickle cell always come first. So if it's quality of care, we need to increase compassion that is involved in the quality of care. Okay, we can have a conversation, right? But if it's numbers and how I did, anyways, you have to tailor it to the audience that you're speaking to. But anybody can talk to me, and groups like this, I love to talk, because at the end of the day, if we are stronger as a community, then we can support each other by being stronger to the face of the healthcare system, where hopefully in the next, my vision for sickle cell is, of course, eradicate sickle cell altogether, right? But for me, I want a place where it doesn't matter the zip code, it doesn't matter what you look like, it doesn't matter how old you are, it doesn't matter, your, socioeconomical background. You should get the compassionate quality care that you deserve as a human being. And I think once we get there, we're all winning.
Oh, absolutely. I know we always, I've said in the ER before, please treat
Yeah.
my child.
Can we go there? Yeah,
Please treat my child,
yeah,
not the statistic, this person, this individual. So I think it's so important, especially, of course, when we're talking about our adult warriors, is to treat them as an individual. They are people. We are people.
exactly.
Um, and they are sickle cell warriors. They're not sicklers. They are people that has this chronic disease called sickle cell disease. And I think that's an important piece to get across, is the empathy, the care for that individual that has, presented in your presence
Mhm.
as a care provider. So I think that's a very important education piece.
Yeah, no, definitely. And one of the things that any presentation, I'm huge on non-judgment and non-assuming. So any presentation, whether it's a group of clinical team that does treat individuals with sickle cell disease, I'm starting from the basics. And even if I like kind of quickly go through it, but one of the very first slides I always have is the painting by Hertz Nazir, right? He's a sickle cell warrior in Connecticut. I knew him personally, and he painted a series of what life is with sickle cell. And I have them close their eyes. I'm like, all right, humor me for a second, right? And imagine a rainstorm of daggers on your bones. And I usually let it sit there,
Mm,
because oftentimes it's like, well, what does the pain feel like? No one can really explain it. I mean, the pain is debilitating. I wouldn't wish it on anybody. It's just unpredictable, right? And really emphasizing how unpredictable it really is. And really saying, as inconceivable as that is, that's what the pain feels like. That's what I really resonate with the most. And that's usually the opening jaw drop of, okay, let me pay attention. And usually when you bring it personal, I think it makes a difference. And I've experienced stigma. I've experienced the delayed and waiting on the wheelchair of hours in pain, and just really not being able to speak for yourself. And because you're in so much pain, you can't even speak, right? Um,
mhm,
so, and just looking at the pain on my mom's face and my dad's face, it's heartbreaking on so many levels. And we're here to change the narrative. We have full lives outside of the hospital. The
right.
ER, we don't want to be in the ER. Trust me, we don't
Right.
want to be there. And so, just changing the narrative is time. I think the tides are shifting a little bit. I think COVID kind of showed that health disparities and certain population of people are really disparaged. I think we as a community have to capitalize right now,
Mhm,
because our voices were not heard in the past for very, very loud. But I think the voice is getting louder, and I think with the right people in place, education and awareness, we can make some strides, because I think more and more people, because we have new meds, right? 2017 brought on new meds since 20 years before, right? Hydroxyurea. That means more nurses are touching, you know what I mean? Base with medications, right? That they're
mhm.
unfamiliar with. And, more education needs to be given to them anyway. So we might as well capitalize as we can.
Oh, absolutely. I know someone just mentioned a comment. Most patients don't
Right.
die from, yeah, but the complications of it.
Exactly. And that is what's key, right? It's understanding that it's not sickle cell itself that, ultimately, can cause a death, right? It's
Mhm.
usually the complications. Was there a delay in the care? Did you contact my hematologist? Oftentimes
Right.
they don't, right? And often, if you don't want to battle, let's just call it what it is. If you don't want to go to war for yourself in that moment, just say, nothing can be, you know what I mean? Please treat me appropriately, but contact my hematologist because
Right.
they know everything you need to know. And so
Absolutely.
that's always something you can do for yourself, definitely. But no, complications is definitely what.
Absolutely. And she's also mentioning about how you said our voices weren't heard in the past as
Yeah,
loud, but now we can be louder and we
yes,
come together and we can share through events like this,
definitely.
um, to share with our community and to have a discussion.
Yes,
Let the people know what's going on behind
yes,
the scenes and the challenges our warriors face
yes.
in day to day life.
Exactly. And I think when we are louder as a community, I think individuals feel the support
Mhm.
because I've treated patients and I'm grateful to say that wasn't my personal experience, but some individuals have said I can't even talk to my family about it, right? My cousins don't even know, right? And that's how we continue to have sickle cell disease, right? Because before 2006, it wasn't mandatory. That 2006 is what brought about when all 50 states were mandatory newborn screening, right? So
Mhm.
generations before 2006 didn't even know they carried the trait because we know trait is often asymptomatic, right? They don't carry symptoms or manifestations or complications of sickle cell unless extremely pushed like military, athletes and everything. That's a whole different story. But you if you can't even talk amongst your own family about it, how can you talk and stick up for yourself to the public,
Right.
right? So we just all have to share and support each other.
Oh, absolutely. I mean, that's why in the beginning, before we started our nonprofit, one of the things that I had to get off of my woe is me box, because I felt like
Yeah.
before, I didn't share. I didn't share our story because I felt shame, embarrassed, guilty for giving, my son the worst of me. That's how I felt and saw it. But I realized it wasn't helping our situation. And that when I did share, it encouraged other people or it informed people. And so it can be empowering. And that's how change is made is when we share. And I tell you, over these years, I've met some amazing work. You guys who are listening, if you don't know a sickle cell warrior, if you don't know Braden personally, or if you don't know Nicklaine, you connect. And I know we've been introducing to our followers, some sickle cell warriors. They are some amazing people.
Yeah.
Their stories are so powerful, full of resilience. And I know a lot of times we talked, Nick Lane, before, and this is an invisible disease. So sometimes you can't see the pain. You can't see all of the internal damage. So it's not like you walk around, oh, they have sickle cell unless they say it. So um, the stories are so powerful. You should meet or should listen to their stories. And I'll brag on you all day long, Nicole.
Thank you.
All day.
Oh, thank you so much. But yeah, I mean, it's tough. It's a tough journey. You have to kind of learn at a very young age how to be independent minded, right? And advocate for yourself because you have to learn your limitations. I mean, and even certain things that they do implement for our protection, and I know is necessary, and definitely I advocate for. But even being in elementary school and having to forego gym, right? I had to sit on the bleachers while everybody else was on the floor and doing the, activities. It really does impact your mental awareness of self and why am I different, And so to have strong parents such as you, Brenda, and just the community as a whole and advocacy groups and community groups, just in the school system, right? That's really where it starts. That's where you have to really, I remember having to go to the nurse's office 3 times a day. Can you imagine in elementary school? 3 times a day for 2 cups of water each. And, I was very close with the nurse, but my classmates would look like, where's she going again? You're right. And you really have to learn how to be, what, this is what I need.
Yep,
And that's it.
absolutely. And be okay with it. Um,
Yes,
uh,
exactly.
we're so grateful
Honest
for you.
conversations.
Right,
Exactly.
right. There is power in sharing, so much power.
So true.
Yep. And I'm glad you mentioned that about the school. I think I know for our story, we were very, very fortunate. Even now, Braden is in high school, but I had to share. I had to be open. I had
Yes.
to communicate effectively with the school nurse, with the guidance counselor, with all of his teachers, and say, "Look, this is what we got going on,"
Yes.
and he's going to learn. But these are the things that needs to be in place to make sure he's in a position to learn well. And he grew up with a great set of friends. They all look out for each other, and the parents. So very supportive from elementary school to middle school and now high school, even though the first year was virtual, thanks COVID. Um, but we're back in person right now. So, communication is important. On top of
Definitely.
that. Yeah.
Definitely. I think, take advantage of those parent teacher nights, right? Have that side conversation with each teacher, and it doesn't even have to be lengthy, right? Just say, look, this is something we're dealing with. And if it's not necessarily you to each teacher, at least have a way that the nurse can incorporate that knowledge with the staff because, they're the key, they're the healthcare professional. And, when they understand and they help to have the other staff understand that we're no different. We learn the same. We just, sometimes need that extra care and attention, much like anything else that could possibly happen. Right. And so it's just important to have those conversations and not shy away from, oh my goodness. And I do understand because I've heard the very same things from my parents. It's like, oh, I feel like we did this to you. It's like, okay, yeah, but let's move beyond that. It's
Yeah.
like, okay, we know this is the reality, right? Okay, we know it. But the more I know and the more I can speak up, the better it is for all of us, right?
Right.
In the family cluster. And so, yeah, definitely have those conversations, but the nurse is first. The nurse and the principal, whoever sets that up, but usually the nurse can help to guide those conversations too.
Okay. Question. Okay, let's move into a slightly different topic.
Sure.
Um what are your thoughts or how with the opioid crisis that we've been dealing with over the past several years? Um and how it's impacting our warriors.
Mhm.
What are your thoughts behind that? As far, especially the education piece for healthcare providers and opioids and pain and yeah.
Yeah. It's a okay, so it's a large undertaking. I think we have to understand that much like let's just I'm trying to give another example, cancer pain, right? Pain is pain. And what's tough about it is that our pain in particular is so subjective, right? Because from a very young age, you've learned to cope with the pain. And, it's astonishing to me that I still hear, well, they were on their phone. Yeah, that's a coping mechanism. They're like, oh, really? Yes, that's a distraction from the pain, much like a massage or TV, whatever it is. And so, therefore, we should not, determine what their care looks like based on what we perceive they look like, right? Because I may sleep, but that doesn't necessarily mean the pain is gone.
Right.
So,
Right.
putting that aside, what we already know, the opioid epidemic um, really drove on a government level a different way to look at narcotics. Now, the issue is we're still dealing, sickle cell affects predominantly, I'm very transparent, so let me know if I'm going too far, Brenda.
Yeah. Go
Okay. But it affects us, right? It affects Black and brown people. And so there's already this stigma and this health disparity attached to our particular community. And so it makes it very difficult because, on a government level, the opioid crisis was really an issue, right? What happened essentially is, when we have providers who openly just say, okay, what is it that you need? Other people tend to manipulate the system, which then is just a downward spiral to then reflect on everybody else, right? I think one of the is, it's so important to have a rapport and a trusting built relationship with your care provider. I think they ultimately hold the cards between where you go, where you are now, and where you go, and how your sickle cell is managed, right? And being on both sides of the fence, I'm going to be very honest. I think compliance has a major piece to do with it, okay? Because oftentimes when restrictions are put, or they'll look, okay, let's say, I'm just going to give you a scenario. So let's say you're going to your annual appointment with your hematologist. Okay,
Mhm.
so usually with sickle cell, they're the ones prescribing. They have a database, right? Usually they track your prescriptions and everything like that. We just have to, because we're licensed providers and things like that. So what is important, and one of the drive home methods I always take home things is, try, I know it's difficult, sometimes you don't feel like it. Telemedicine is helping now because of COVID, right? Because sometimes we're not really up to going to an appointment if you don't feel well. That's just the reality of it, right?
Mhm.
I feel like it's important to try to maintain a rapport and a compliance as much as possible. There are outside forces that we who know better are trying to fight, but help us do our jobs too. Do you know what I mean? Because
Okay.
the opioid, we know the pain is real, the pain is subjective. We have to help that gap lessen between healthcare professionals who don't really understand with healthcare professionals who do understand, right? To close that gap. But what I mean by help us is, you know, by maintaining a compliance or at least a communication with your healthcare provider, they are able to support you all the way around, right? Because if they see, like, okay, well, they missed 2, 3, 4 appointments in a row, but I don't really know why. Okay, now they're trying to fill their prescriptions a little earlier right now, that because that gap in rapport is kind of broken or shaky a little bit. So that's when the question marks come into play. And then the question marks build. And then in the background of the opioid crisis, I think, or epidemic, it's just kind of makes it a little difficult to really bridge that understanding. So when you have a trusted provider, whether it's your hematologist, and I encourage everybody, because I had to teach myself that sickle cell is so much a part of what we deal with, right? So, oh, I only need my hematologist, right? Should they know me, right? No, primary care holds a very specific set of knowledge and skills as well beyond what hematologists know, because I always often think of the primary care physician as like the quarterback. They're like the coordinators of everything, right? It's like, okay, well, you have a hematologist, yes, that's your specialist, but let me make sure your blood pressure is okay, your eyes
Right.
are okay, your lungs, everything. So have a primary care physician as well as a hematologist, okay? But the more they know you, the more they can advocate for you. There are letters we've written, okay, to legislators about certain individuals that we're like, no, they need their medications. Do not limit. We can contact the insurance companies or Medicare, Medicaid, and say, look, we advocate that this person do not be limited on how much they can get, because we know based on their track, you know what I mean, their history, this is very important. This is what's keeping us to manage them well and out of the hospital. So the more you have a rapport with your healthcare professionals, the more they can advocate for you. And I don't think we can change the opioid crisis. The history is the history, the background, the landscape of what we're living in is what it is. Unfortunately, we still rely on opioids. We still rely on narcotics because that's what we need. And
Right.
so the more you have a rapport, the more we're able to combat that and not get restrictions on what it is that we really do need. That's
Right,
the best way
right.
I can, you know.
Yeah, and I mean, and thank you for that. Thank you
Yeah,
for that. But and then telling both sides of it, and it all really it also falls back on education piece.
exactly.
Um, Especially, I think, well, I saw a video, a post on social media about, someone, a warrior, was saying, your labs don't always dictate that there's pain. Your
No,
hemoglobin doesn't always dictate that there is pain. And so understanding and believing the patient when they say they're in pain.
that's the key.
Yeah.
I think, I often stress how invisible, it's so subjective. How can you tell me about my pain? Like, you can't see it, right? If I came in with a gunshot wound or a heart attack or a stroke, there's measures that we can definitely see, right? But pain is that invisible vital sign, but it's just as much important as any other vital sign. And my 6 may not be somebody else's 6. My 10 may be somebody else's 3 because they've had more severe case and more, you know what I mean? So everybody, and one of the things I stress too is no two sickle cell individuals are the same. No two. I experience sickle cell completely differently than somebody else, right? Braden experiences it completely different than somebody else. And so once we get that word out there, then again, we can start to build that trust and rapport because I don't want to be here. I
Right,
want to be home in bed. I
right,
don't want to be in the emergency room. So that's why we're really trying hard to build these dedicated clinics to really take that burden off of the emergency room, both sides, right?
right,
To really kind of have that specialized focus population and environment for this population of patients.
right. And I think that will be good.
Yeah,
Like you said, sickle cell will be their, these patients will be their focus,
exactly.
and their
Exactly.
specialty. So, to ensure that the care is given.
Exactly.
So, I know you did mention your brand, educate,
Yeah.
serve, testify.
Yes.
Now we've rolled all over that education piece and stayed on it for a while. Do you want to touch bases on what
Sure.
that is?
So the serve, like I said, I help clinical teams build or improve their own dedicated spaces. So one of the ways in which I do that, I'm partnered with the American Society for Hematology, ASH, and we
Okay.
do an annual conference where last year I think we had 20 clinical groups come nationwide into one space. We did it virtually last year, but the year before, I believe it was in person in DC. And so what we do is we actually have sessions. It's over the course of 3 days. They're ready. We do breakout groups, right? But on a personal one-to-one basis, I'm actually able, and I'm actually helping a team right now where I actually build their policies and protocols and, kind of help alleviate those hurdles that I've already been through. Like, okay, this is you need, no, we have to have scheduled appointments as well as you must call in before you come for treatment. So I know what to expect. I don't want, you to come and we don't have a chair available, right? So, that communication piece and how to build partnerships with the emergency room, right? How to get buy-in from a hospital system to say, no, this is the care we need, not only because it's humanity and this is right,
Right.
but the emergency room traditionally is usually like 50%, 70% they're getting admitted or discharged home, and sometimes that decision was inappropriate, right? If we open up a clinic, when we opened up, the emergency room was admitting 50%, discharging home 50% of patients. What we came to do is we took the admission rate down to 12%. What
Wow.
we know is if you have safe, aggressive meaning hourly administration of medication, and you stay on top of it, your chances of going home are up to 90%, and now we're not admitting people with just typical crisis. No, we're admitting the sick of the sick because they need to be admitted, right? And if today didn't work, okay, come back tomorrow. If I don't have a chair, do you want to, an injection? And you try again tomorrow if you want to, avoid the emergency room as long as it's safe, right? So building policies, protocols, and really guiding that. And then the third is testify. So that's, near and dear to me because I know, sometimes you don't get the quality care you deserve. And I think when, are we asking, because again, sickle cell doesn't necessarily bring about a death, it's the complications. Or was it on the clinical team, right? Was a transfusion delayed? Again, did you not call my hematologist? So oftentimes, because the family for so long heard, oh, sickle cell, it's going to be a lower life expectancy anyway, they're not asking for autopsies. They're not asking, so what really happened? Because the healthcare system, they're going to protect themselves, you know? And sometimes the standards of care are what we know to be right under our licenses, and education wasn't met up to, right? And so, did the, did the team get notified when the vitals were changing? Was a delay in communication while the patient was admitted, right? So, were they supposed to be transferred to the ICU, but it happened later because, I don't know, a bed wasn't available, whatever the case is, you know? So certain things I just dive really deep into a chart and say, okay, this could have been done differently. This could have been done different under the scope of the nurse that I know they could have done differently, right? And
Mhm.
so from there, now I don't get hired as an expert nurse witness or legal nurse consultant directly from an individual or their family. Usually they already have a lawyer on board and the lawyer contacts me and then I jump on the case. But usually what I do is I review the case and I say, okay, we have a case here, right? And it could go both sides because sometimes the hospital wasn't at fault. They did everything they could, right? And so it's fair on both sides, right? And so, and that's how I move forward with that. But I think it's important to know your rights and to know what options you have. And if you have any questions, just ask, right? Because sometimes you just genuinely don't know. And so, educate, serve, and testify. That's what I do. Yeah.
Wow, this is amazing. Oh my goodness. Mm.
Thank
And
you.
I mean, we talked about education. You shared with us about what you do. You share with us about serving, and even with the testifying portion of it, you're expressing the importance of accountability.
Correct.
And you shared tonight. I mean, this isn't a simple illness, you
It's
know.
not.
There's a lot of, um, things we're juggling. And, like we touched on, you've got to take care of the whole person and
Mhm,
so many things to consider.
mhm.
So, the education piece, the accountability as well. And, if we are educated, like as caregivers, and then those who are warriors as well as what our rights are as patients,
Mhm.
and people.
Definitely. A huge problem right now that we're trying to really help combat is we don't have enough. Let's just call a spade, right? We don't have enough providers who are specialized in sickle cell.
Right.
Okay.
Mhm.
We oftentimes do have to rely on the primary care physician to be our care provider. Depending on where you are, you may not have a sickle cell team, right? That is readily available in your location. That's what we're trying to change, right? On a government level, all the way up, because change is coming, people. So,
Mhm.
this tide is shifting a little bit. I'm talking loudly, but not only
Right.
do you have to advocate, because let's go with the first 24-hour emergency room that was solely for sickle cell, Grady Hospital in Atlanta. What they did is what happened was a death in the emergency room. That's what
Mhm.
happened. The delay in care was so great that the person ended up unfortunately passing away right in the emergency room. And the community was so, together and really propelled forward to now they have a full 24-hour emergency room solely for sickle cell.
Wow.
Like, that is phenomenal, right? And so that's what we're trying to really advocate for and teach individuals and providers that, look, we can do this better. There's a way. And what I say is, if you know your provider is not their strength and knowledge is not sickle cell specifically, we have resources. For example, Hopkins has an echoes pretty much where experts like hematology and everything get together, and providers nationwide can tune into the echo on virtual and bring forth a case study, or a patient who's particularly difficult, or they're having a question. There are resources, so don't think you have to suffer in silence. Reach out to us, and reach out to sometimes we can connect you with an expert or a hematologist that is specialized in sickle cell, to then speak to that primary care, or that hematologist that may not know sickle cell as well, right? And so just know that you don't ever have to suffer in silence. Your zip code does not determine what care you get. We're trying to change that, but change is coming.
Oh, it's definitely coming. I mean, even through conversations like this, and spreading awareness of businesses such as yours, services such as yours, to the community, a service that is so needed. You know, this
Yeah.
is all a part of it.
Right. And I think it's certain groups that we tend to overlook. Like, for example, Sickle Cell Awareness Month, almost 2 out of the 4 Sundays, I was in a church, right? And of course, they were very COVID safe, and, all
Right.
that taken into account. But I went and I spoke to churches, because oftentimes we as a community don't know enough about us. And so if we don't help ourselves, we can't expect, the outside to do it for us first. We have to really be supportive of each other and then expand out,
Oh,
which is what
wow.
we're all trying to do.
Absolutely. I'm glad you mentioned that, because it is important for our community to
Yeah,
know more about it.
definitely.
And then us all together can share, because I know that's one of our goals as an organization. I know one time I said I want everybody in the state of South Carolina to know at least one fact about sickle cell disease. So it could happen, but we
It
just have
will happen. Yes.
it will happen, and we
Will-
got to keep talking, keep sharing, keep
Exactly.
spreading awareness. um, yeah, and I know I'm gonna go back through some comments here.
Sure.
We're talking about um meeting some warriors, and communicating and connecting. And I know the Sickle Cell Communities Consortium uh is where I met a lot of warriors, and I did as well. And I'm a part of the our organization is a partner of the Sickle Cell Consortium. So and we're proud of that partnership as well. And it's an opportunity to communicate and exchange ideas and knowledge and experiences, expertise, things like that, with so many different people. And it's exciting. It's empowering.
It really is. And, the more you talk and the more you really know, and, you kind of see light bulbs go off on, people's eyes, like, I never knew, it's really exciting. It invigorates you to do it even more, right? And I'm so passionate about this. And, it's interesting when somebody knows nothing at all about sickle cell, and they're like, I just never knew. It's like,
Right.
you know,
Right. So, and we had another comment. She liked your line where you said primary care physician is like your healthcare quarterback.
sure.
That's a great analogy.
Right.
So, it's a great analogy. Nicklaine, thank you.
You're very welcome. Stay
Yeah.
strong, everybody. Be strong. I'm gonna go.
Just be you. Be the
Yeah,
amazing
be
you.
you and stay strong. Yes.
Yeah. Is there, I know we've been talking for a while,
Yeah.
and I don't want to, wear out my welcome, but you will be back. We will definitely have you back
Oh,
to
I would love to
conversate
be
more.
back. I would
Yeah,
love to be back. Definitely.
we appreciate you being a part of our platform, and to everybody who's listening live, thank you for joining us, and those who are listening on the replay. This is Miss Nicklaine Paul. Hopefully you've seen it from the beginning. And Nicklaine, we listed your website earlier.
Yes.
We'll
So it's
include how can they connect with you?
sure. So I do have a website,
Mhm.
www.sicklecaresolutions with an S.org. Sickle Care Solutions, and my email is, and well, actually, if you go to the contact page, it will direct you to my email. But
Okay.
my email, if you have just a question or something I can help with, is n as in Nancy, Paul, Paul, .rn at sicklecaresolutions.org. But
Okay.
the website is probably the best.
Yeah.
I'm
Yeah.
trying to get on social media, Brenda. I'm trying to follow you. Okay. I started
Come
the page.
on.
No post yet. I'm just like,
Come on. Come on over there. Um, but yeah. Okay, .org. Make sure I
Yes.
got that right.
Yes. It's npaul.rn. Yes. At
Oh,
Sickle
and I
Care.
missed
Yep.
that. Well, let's hide that.
Yep.
But yeah, we're so excited that you joined us. Is there anything you want to end on? Any last minute
I
information
just
about
want to
something?
say, honestly, thank you so much for everybody on this platform, all that you do. I know, sickle cell needs to be heard more of. It's coming. The tide is shifting. Stay
Mm.
strong, educate, be aware, and just do the best that we can, right? And advocate for yourselves as best as you can.
Oh, absolutely.
And just know your resources and reach out. Don't suffer in silence, please.
That's we got some thank you coming in. You're welcome. Thank you for always tuning in to our Tuesday chat for Giving Hearts. We appreciate you so, and we appreciate your informational your posts that you post, sharing information with the community as well. So you guys, Nicklaine ended on a great note about advocacy and sharing and connecting. So again, we appreciate you, and we appreciate all of you for listening. And coming up later this month, we're going to have Dr. Carla Roberts, Braden's hematologist. She's the hematologist for the majority of the sickle cell pediatric patients at our local Prisma Health Children's Hospital, Midlands, here in Columbia, South Carolina. So she's going to join us again in October to give us an update to educate us some more. So you guys get your questions ready. I'll post more about that as well. And we have a couple of other special Tuesday chats coming up. So stay tuned. Don't miss out. So you guys have a beautiful night. Thank you for joining us, and we will see you next time. Good night.
Hi, everybody.